Lesions and tumors of the spleen are rare, but any pathology can give us a hint for a maybe severe disease which involves the splenic tissue. Lesions may be cystic or solid, or may entail both structures. Cysts may be congenital or the result of an injury, a necrosis, or an infection. If an infection with parasites, such as echinococci, has been excluded, a cyst of the spleen usually needs no more further investigation. Other hypoechoic lesions of the spleen can include bleeding and cysts, infarction, granuloma, or in some cases a malignant lesion such as lymphoma. Hyperechoic lesions are mostly benign, such as hemangioma, splenoma, or granuloma, but also metastasis can appear hyperechoic in the spleen. When you find an inhomogeneous mixed lesion, it is maybe a necrosis or an abscess, but it can also be malignant or a metastatic disease. One of the most common lesions of the spleen is the splenoma, or so-called hamartoma. It's a hyperplasia of splenic tissue and shows a very intensive, rapid uptake of contrast agents, and sometimes also a quite strong vascularization can be seen, like in this case over here in color Doppler, and also on this video clip we can recognize the great amount of vessels inside and around this lesion. So once again, there's a hint for the presence of a splenoma, which is a benign tumor of the spleen. When we use a contrast agent for the examination, the diagnosis of a splenoma becomes even more precise. In this particular case, we see a rapid and strong uptake of contrast agent in the arterial phase. And in the late phase, the intensity of the contrast agent does not decrease. So there is no so-called washout, and therefore no hint for a malignancy. Primary tumors of the spleen are rare. In this case, we see a lymphoma. This small tumor over here with a small rim of hypoechoic tissue around, so a so-called target sign. But it's not possible to differentiate between benign and malignant lesions. In this case, we see a benign lesion, a splenoma, and it has also inhomogeneous areas, and we cannot distinguish between benign and malignant. But sonography can do a great job by identifying any lesion. So in this case of a chronic lymphatic leukemia, we can detect areas of lymphatic tissue that is involved in leukemia. Using a linear probe increases the resolution, and we get a better picture of the tissue of the spleen. We see a normal tissue over here, and in this case there are larger hypoechoic areas, which is typical sign of a chronic lymphatic leukemia. Also in this case we do not know, is there a tumor, is there a lesion or not. When we use a contrast agent, it's very simple. In this case there are lesions in the spleen, and in this case it's normal splenic tissue, so no lesion can be found. Metastases of the spleen are really rare. They can be hypoechoic, isoechoic, or hypoechoic. Maybe we can find a target sign, which means a hypoechoic rim around the lesion, and they can originate from lung cancer, breast, ovarian cancer, or melanoma. In this finding, we have hyperechoic areas over here and hypoechoic areas around, so maybe it's a target sign. And this diagnosis was confirmed with contrast-enhanced ultrasound, and it's very easy to detect multiple lesions in the whole area over here. Now I want to show you a pitfall. When we scan the left upper quadrant, we find this hyperechoic tissue over here, and in the very uppermost edge of the left upper quadrant, the slightly hypoechoic parenchyma over here. In this particular case, we find an enlarged liver that get in touch with the spleen in the left upper quadrant. So a kissing of the liver with the spleen. We should not mix it up with a hematoma. Why do we scan the spleen? There are some quite good reasons for that. In the case of injuries, especially to the left side of the body, it may be life-saving to recognize the laceration in time. Only in this way will it be possible to save the patient's life by means of an emergency operation and to prevent the patient bleeding to death. But here also the following applies. Skill comes with practice. It is essential that the spleen be depicted in the course of every examination of the abdomen, to measure and to document it. This routine will it make easy for us in a case of emergency to find the spleen and to detect potentially critical conditions. Performing ultrasound on the spleen, we can detect an enlarged organ, we can identify lesions, and in the case of an injury, sonography is the best technique to find signs of an acute bleeding and laceration.